Okay, so I'm going to do an update on my knee. As of today, I am 2 weeks, 1 day post-op. So I'll go over week one. I'll go over physical therapy. I'll go over the doctor's appointment I had yesterday and how it's going forward. So first week post-op was not fun. It was pretty painful. Um, I definitely was having it's a hard time getting around. I started physical therapy the second day after my surgery. So my surgery was on the 24th of February. So I started PT Friday, um, on the 26th, and it was pretty rough. They started to bend my knee. They bent me to about 20. I think they said 35 degrees on my first visit. No, it was definitely very painful. But it was a good first step. So since then I've been doing PT twice a week. So I'm going Monday and Wednesdays. So last week, they were able to get me bent to about, um, I think they said 82 degrees, which isn't bad. They also have me doing heel slides. So what that is they have um, it's basically a strap that goes around my foot, and you grab onto it and you pull, and it bends your leg like this, with this being your knee, and it bends it up. And I do that for 3 sets of 20 reps. And so that was last week's PT. So this week's PT, they definitely really bumped it up. So I had to do the 3 sets of 20 heel slides. They also started, they physically bent it. They got me to 90 degrees now on Monday. So I'm at 90 degrees bending. So again, we did the heel slides. They bent it. They hooked me up to a stem to get my quad firing. Right now, my quad is my hand or my thigh muscles, my quad muscles are not firing, and that's why my brace is still locked. As soon as my quad starts firing again, I should be able to get my brace bent and get off of the crutches. But the quad not firing, that's normal for a surgery like this. So I've been using the power dot that I have, to try to stimulate my leg muscles to get working again. I've also been using my Theragun on my quad because it gets really tight. Basically, for me trying to move my leg, my IT band, and just overall quad muscles are really tight. So that's part of what they do in PT too. They're digging into my quad to loosen it up, which is pretty painful as well. Other exercises they have me doing this week are they have a foam, the thing that you roll your back out on. They put that under my knee, so my knee's bent a little bit, and I have to drive my heel into the ground. I had 2 sets of 10 at 5 seconds each rep, and that's to get my hamstring firing. And then they also have me try to lift my leg. I need help from the PT at this point with that. Still can't lift my leg on my own. Again, that's normal because my quad's not firing. So a lot of what I'm doing is trying to get the quad going. They put me on the bike, which really sucked. I'm not going the full way around, but my left leg is pushing the pedal to bend my right knee as much as it can. That's painful, right? But I do 10 minutes of that. So that's what they've all been having me do at PT. Next week's going to be brutal. I'm completely off the painkillers. I have been for over a week now, almost a week and a half. So I'm not taking any more of that. My pain's not bad at all during the day. It gets a little rough sometimes when I'm moving around on a lot. It's definitely rough after PT, but I threw some ice on it, and it pretty much goes well. My doctor's appointment was yesterday. I got my sutures removed, my stitches removed. Got an X-ray. The X-ray was good. I go back in another 2 weeks. Hopefully, just as another checkup. I'm able to drive now, which is good. I can get in and out of my truck and operate the gas pedal and brakes with my right foot, no issues. So I'm gonna go to Strongman Saturday this week just to hang out. Excuse me, and then I plan on going to get back in the gym next week, starting Monday, hopefully, for some upper body, just light stuff to get this moving. So yeah, that's the update as of now. If anyone has any questions about anything, or if anyone got injured their knee and want to know what my experience was like, just let me know. And that would be it. Oh, the other thing that I'm gonna discuss real quick is I'm back on most of my supplements. So I'm taking my multivitamins again. I'm back on vitamin D, which is real important. So vitamin D, vitamin B12, and vitamin C. And I've been drinking, been making smoothies. There's this different things I'm putting in smoothies that are very high in vitamin C and antioxidants, as well as turmeric and other anti-inflammatory things I put in these smoothies, and they seem to be helping. So that's good. But again, thanks to everybody who's keeping up with this. Again, if you have any questions, let me know. Thanks.